HELC Health and Safety Procedures during COVID-19. At this time, we are following guidance from the Center of Disease Control and Minnesota Department of Health. Here is our exclusion guidance during the COVID-19 pandemic. Please note we will be sending home or denying entry if any of the following symptoms are present: a fever of 100.4 degrees Fahrenheit or higher, new onset or worsening cough, or shortness of breath. All staff will enter and exit through door B. When entering, staff will take their own temperature and answer 4 screening questions. What is your temperature? Does the temperature exceed 100.4 degrees Fahrenheit? Do you have a cough? Do you have shortness of breath? If the answer is no to all of the screening questions, the staff person may enter the building and wash their hands. All families will enter and exit through door B as well. Families are being asked at this time to only have one parent or guardian drop off. Families will be met at the door by a screener from the HELC administration team. Parents will be asked to take their child's temperature and answer 4 screening questions for their child. What is their temperature? Does the temperature exceed 100.4 degrees Fahrenheit? Do they have a cough? Do they have shortness of breath? If the parent answers no to the screening questions, the child may now enter the building and wash their hands with the screener. After washing their hands, the child will be escorted to their classroom. All previous cleaning procedures will remain in effect at this time. These are additions to our current procedures. Ensure hand washing strategies, including washing with soap and water for at least 20 seconds, especially upon children first arriving, after going to the bathroom, before eating, after blowing your nose, coughing, or sneezing. Children and staff should also wash hands upon leaving the building at the end of the day. Routinely clean and disinfect surfaces and objects that are frequently touched. Note that this may include cleaning objects and surfaces not ordinarily cleaned on a daily basis. For example, cots, doorknobs, light switches, classroom sink handles, toilets and toilet handles, countertops, desks, phones, and keyboards. Disinfect using a bleach solution of 3 teaspoons of bleach per 24 ounces of water. Note that this recipe may be stronger than what is currently used for diaper and bathroom areas, and will also be the same for food service and diaper and bathroom areas for the time being. Keep the surface wet for several minutes to ensure germs are killed, and please wear gloves. In addition to cleaning procedures done by the HELC staff, Hopkins Public Schools will be disinfecting the building on a nightly basis. If anyone is confirmed sick with the virus, it will trigger a 2 to 5 day closure to clean, disinfect, and contact local public health officials. In order to ensure the health and safety of children and staff during the day, ratio for every classroom will be 1 to 4. Temperatures will be taken of staff members and children every 2 hours. Infants and toddlers will be during diapering, and preschool will be every 2 hours after the child's arrival. Toys and items that are not easily disinfected should be removed from the classroom at this time. For example, puppets, plush toys and plush chairs, and dramatic play clothing. When possible, create a toy and rotation to ensure toys are being thoroughly disinfected after they are being played with. During eating and rest time, children should be 6 feet apart when possible. Cots will be bleached daily, so blankets will stay in children's cubby when not in use. No outside visitors or volunteers will be allowed in the building at this time. When using outdoor areas and gym, try to stagger times to allow for distancing. When bringing out toys in the gym and outside, please use toys that are easily disinfected. After use of the gym, please disinfect toys and surfaces that were used. During this time, teacher and parent communication will be limited to daily pictures, notes on their children's daily sheet, and phone calls if needed. At the end of the day, families are being asked to call when they are on their way to pick up their child. When a parent is on their way, someone will come to collect the child's belongings from the classroom and bring them to door B. When the parent has arrived, a staff member will pick up the child from the classroom and bring them to their parent at door B.